Hi, everyone, and thanks for joining us. I'm Brandon Baker, Vice President of Development at RAND. We're excited to launch RAND Remote, our new video event series that will bring RAND research, researchers, and their expertise to you. Today's discussion is just the first in a series of conversations on RAND's COVID-19 response. Our goal is to keep you connected to RAND, while also keeping you safer at home, to keep you informed, while we're all practicing physical distancing. It's a whole new way to experience RAND as we navigate this new reality together. Like many of you, my main connections to the outside world right now are virtual. My computer and smartphone are lifelines for staying in touch with family, colleagues, and friends, but also for getting updates about what's happening here in Santa Monica and around the world. Access to information is critical as we all work to adjust while protecting ourselves and loved ones. But access to information takes on a whole new level of importance when people are basing life and death decisions on that information. Our decisions are only as good as the information we have, which is why today's conversation is so important. I'm joined by RAND researchers Jennifer Kavanagh and Todd Helmus, who are working not only to combat disinformation and misinformation during the COVID-19 crisis, but also to counter truth decay. RAND defines truth decay as the diminishing role of facts and analysis in public life, and countering it is one of the critical priorities of our recently launched Tomorrow Demands Today fundraising campaign. Jennifer, Todd, thanks so much for joining us today. We're so grateful that you would spend some time with us talking about what's going on during this crisis. So let's get started. Todd, you've spent a great deal of your career specializing in disinformation and strategic communications. It seems like there's a lot of disinformation surrounding COVID-19. Why is that so widespread now?
Well, thank you, Brandon, for having me here today. This is a great honor to participate in the series. It is widespread. Recent surveys suggest that as much as 30% of at least the US populations believe such things as the coronavirus and the COVID-19 are exaggerated, or that they were intentionally created by governments or media or who knows. So the prevalence rates are high for believing these conspiracy theories. And why is that? It's a scary time. There's a lot of unknowns. This is a new virus. We don't know much about it. We don't have a cure. People are dying. And so people feel scared. They don't know how it will affect them. They could be unemployed. They don't know if they'll lose loved ones, or maybe they have. So people feel anxious and powerless. And the beauty of conspiracy theories is they address both of those concerns. They provide a lot of information that's very certain and fills in a lot of gaps for people. And so they gravitate to that.
Yeah, no, that's really interesting because we're seeing a lot of different narratives every single day with this COVID-19, and one day we're hearing that anti-malarial drugs can treat COVID-19. The next day we're told that they're harmful. Jennifer, can you talk a little bit about how we're supposed to navigate through this chaos and conflicting information that we're hearing?
Yeah, I mean, you're right. It's really hard. Todd already discussed just the volume of disinformation that's out there and the exposure that people have to it. On top of that, we also have a ton of uncertainty about what this virus actually is and how it operates, what actually treats it, whether or not you're immune after having it once. So on top of the fact that there's disinformation, the science behind this is evolving at the same time. And so as science changes and we get updates, that can be really confusing if you're not privy to the details of how that new science came about. And the certainty with which those recommendations are being offered. So I think that one thing to recognize is just to be honest, that there's a lot of uncertainty and that the story is going to change, and that's okay. You have to be comfortable with that. No one's comfortable with uncertainty, but you have to kind of get yourself to a place where you can tolerate the fact that tomorrow you might hear something new and it could be true. The second is to focus on finding things from multiple sources. Seeing things from one source is one thing, but seeing it from 5 or 6 or 7, that can give you a lot more confidence that that information is accurate. The third is to think about what the source is. This is a public health crisis, and we want to listen to scientists and people who are working in public health. I'm not that interested in getting my information about COVID from an economist or from even a political figure, because that information is secondhand. And I'd rather get it firsthand from a scientist or someone who's working in infectious diseases. So thinking about what sources you're relying on, even if you're reading a secondary source like a newspaper or watching a broadcast, who are they quoting? Who are they citing? And thinking about that type of information. And finally, it's just to think about the general source of where you're getting your information. We know from research we've done at RAND that information provided by newspapers and television and online sources are really very different in terms of the types of information they're providing you with. Online journalism is great in many ways, but it has a lot more opinion and commentary and a lot more advocacy. So if you're just looking for facts, you might be better off looking at a broadcast news program or a newspaper.
Yeah, you know, everyone from my mother to my mentor has an opinion on how to respond to COVID-19. So who are some of the people that you're listening to? What are some of the sources, direct sources that you two are going to find out information? Maybe Jennifer, you can start, and then Todd, you could also tell us a little bit.
Sure. So, I mean, I think the key agencies that I'm listening to information from are places like the CDC. Dr. Fauci is a great source. Other people who are working in the development of the vaccine, as well as scientists who are working on understanding this disease and understanding how we can cure it, both in the U.S. and outside the U.S. So that's really the places that I'm looking, are the people who are involved in this firsthand, and can provide that detailed information. And they vary then in how well they communicate technical research in a way that I can understand. So I'm not maybe going to read the scientific journal article because I'm not a infectious disease scientist. But different public figures do a good job at providing that in a way that's really accessible to the average person. So that's kind of how I define the sources that I look to.
Yeah. And Todd?
Yeah, I would say that if I have a real simple answer. I would say if I'm Googling a question, then I would like to see that the answer, that the source is either the Centers for Disease and Control or the World Health Organization. If I'm interested in very general topics or very specific topics about the disease, and if I'm interested in what's happening in my local neighborhood, then the local health departments across the country are conveying information about the key issues that are being confronted in their localities, and that provides a great source as well.
Yeah, that's all great. Yeah, Todd, we've gone through many global crises in the past: financial breakdowns, terrorism, and even other epidemics and pandemics like the HIV and AIDS crisis, the spread of the Ebola virus, and even the SARS outbreak. So how do you think that the disinformation surrounding COVID-19, is it like or is it unlike the disinformation surrounding other crises?
The content is different, obviously, but the characteristics and certainly the factors that are driving the conspiracy theories and the spread of those are probably the same. Crises provide a really unique opportunity for people that are interested in spreading disinformation, fake news, or particularly for our adversaries. Russia took advantage of this back in the early 80s. They concocted and published in sort of sideline sources this notion that AIDS and HIV were a bioweapon, result of bioweapons efforts inside the United States. Those sources started to go mainstream, and 30 years, 40 years later, people still believe that conspiracy theory. Disasters, just as I mentioned before, they create a lot of opportunity for questions and worry and confusion and fear, and lack of credible information. And so conspiracies thrive in that environment. Disasters such as Hurricane Sandy saw a conspiracy theory. A fake news story that the New York Stock Exchange was flooded. The Boston Marathon had its own sources of fake news at the bombing of the Boston Marathon. And the Las Vegas mass shooting had these things go on as well. I think one of them was that one of the hospitals was closed to patients, and so people were not bringing patients to those hospitals. I mean, so these things thrive in that environment.
Yeah, no, Jennifer, I don't know if you have anything else that you wanted to add there as well.
Yeah, I think the other thing that's similar is the lifespan or the life cycle of these types of conspiracies. A lot of them start on fringe platforms, like 4chan or 8chan, and then they gradually move to more mainstream platforms like Facebook and Twitter that more people are interacting on. And then they travel over to broadcast television or cable news reporting on the fact that these conspiracies or ideas or disinformation exists. And so it really bleeds from something that was something on the fringe to something that everybody's aware of. And even if you don't believe it, just having it out there, having it circulating can reduce your certainty about what's a fact and what's not. And as I said previously, I think of something unique about this is how little we know about this virus. And that factors into this as well, making it even more of a problem, even more challenging to navigate the current information ecosystem, and even more frightening for the average information user.
Yeah, so Todd, you touched on this a little bit, but how are the nation's adversaries contributing to the crisis of disinformation? And and if they are, how are they going about it in this particular crisis?
Yeah, and Brandon, they are contributing very well to this, I would say. Both China and Russia, for example, are taking advantage of the situation for their own ends. China, I think, has two goals in the information that they're putting out, at least two main goals. One is to avoid blame for the virus, and the second is to promote their relief efforts. And it's sort of classic China in the sense that they're trying to promote good stories about themselves. On the avoid blame side, a Chinese government official had the temerity to tweet about that the virus was brought to Wuhan by a U.S. military cyclist who came to China from Fort Detrick, which is a biological laboratory. So, that they're pushing out that type of content to get over the notion that it's their fault. And they're promoting the responses. They're using social media ads. They're using bots. They have really harnessed their diplomatic corps to get involved on Twitter and push content out. So they have ads on social media promoting, quote unquote, the gratitude of Italy and Serbia for all the good things China did for them. And in Italy, they've had bots sort of really swarm the social media sphere, advocating goodwill toward China and appreciation toward China. And some of that's working. I think one survey suggested that there was a 52% increase in people supporting what China was doing in Italy, and support for the EU is down. So, they're doing well in that regard. Russia, their goals, I've read their goals are to protect their image and question the international response, and they're certainly doing that. I really think that what Russia's doing is a continuation of the disinformation campaign they started in 2016. My colleague Chris Paul likes to talk about the fire hose of falsehoods, and that certainly applies to this situation now, I think. They're putting out just a lot of content that is not internally consistent, but gets the job done. So they're showing confusion about treatments, telling people, sending out content. A lot of this content is coming from Sputnik and from their own sort of allied media sources, saying don't wash your hands. Washing hands doesn't remove the virus. Zinc is a good treatment. Hydroxychloroquine, why not give it a try as a treatment, which we know now is not effective. And downplaying the pandemic. So they say it's a hoax. They say the mortality rates are exaggerated. They say it's a power grab, that it's manufactured by the media. So they're pushing out a lot of this content, which I think really has the same goals they've always had, and that is to sow division and chaos within the American public.
Yeah, I would just add that I think Todd highlights a really important distinction between how Russia and China act on this. Russia doesn't really care what people believe. They just want to confuse everyone. They want people to not know what's true and what's not, and to have uncertainty and distrust. Whereas China has some very specific messages that it's trying to communicate to get people to believe and follow on. And the other thing to note is that our adversaries are really much better in this information space than we are at this point. So even though there's efforts on the U.S. side to counter these messages, it's not clear how effective those have been thus far in some areas. In some places, it seems like the Chinese narrative isn't really catching hold. So in Asia Pacific region, there's some reporting that suggests that people aren't really falling for that narrative. The other thing to note is that Iran is a player here as well. Their activities are less sophisticated, and they tend to just join in with China and Russia to kind of signal boost those messages, but they're also a player here as well.
I've also read recently that China, Iran, and Russia are starting to coordinate some of their information campaigns. Mm-hmm. So that's a really interesting development.
Yeah.
So with that coordination, and with the fact that Russia and China and Iran are stepping up their disinformation campaigns, a lot of this is obviously going to social media. So are social media companies doing anything to help stem the flow of disinformation? Todd, maybe you could speak first, and then Jennifer, I know you've done a lot of work on this as well.
Yeah, real briefly. So Facebook, for example, I think the two main tools that the social media companies are using are content removal and warning labels. And these warning labels often include links to news. Facebook, for example, has removed about 2.5 million pieces of content in April. They also put labels on 50 million posts. So, business is very good on that front. Twitter just recently came out with a new policy on warning labels. So I think those efforts are very good, and they're certainly effective to a certain extent. And I think some social media companies that are not employing those tactics to reduce content or warn audiences, are certainly probably contributing to the rise of these conspiracy theories.
So I've been thinking a lot about what else they could do. I mean, this is a massive problem. Todd spoke about the volume of things that they've removed. It's like a drop in the bucket, right? There's so much more disinformation, and more is coming out every day. So thinking about what they could do to stop, especially things that end up going viral, false information that really spreads like wildfire. And so one idea that I've been thinking about, I'm not exactly sure how it would work in practice, is something akin to the pause that's put on the stock market when it drops below a certain percentage of its volume, which is there's a 15-minute break, right? Like a timeout for everyone to just kind of calm down and settle before we resume trading. So thinking about when social media companies, especially in a crisis period like this, see something starting to go viral, just put a pause on it and verify it before they let it go, because that could have the effect of tamping down some of this virally spreading disinformation, things that get 10 million or more hits on a given day. And you could work with emergency responders to make sure that it's not their emergency notifications that are getting paused, but that would have the effect of not censoring speech, but making sure that the information that's going viral in a crisis period is accurate. So there's a lot to think about in terms of how that would actually work, and how you would make sure that it matched with First Amendment rights, and how it would technically be, how disinformation would be detected that way, or how you'd identify which tweets or which posts to flag. But I think that there's something potentially to that model as like a tamping down function to prevent the rampant spread of false information, like we've seen sometimes in this context. Like example would be the pandemic information, which spread so quickly.
Yeah, I mean I think that's a great example, Jennifer, because even despite the best efforts of the social media companies to shut that down, I think they had about 10 million likes, comments, and shares on Facebook. So they're employing a lot of tools, artificial intelligence and fact checkers and the like, but their current efforts are certainly not enough.
Yeah, that's a really, really interesting idea, and it'll be interesting to see if that could come to play. But then also, just even with the warning systems that they're putting in place, it'll be really interesting to see the effectiveness of that in the weeks and months ahead as we're dealing with this. We've heard a lot about trust in government and trust in the media being low. Do you think these trends matter when it comes to the spread of disinformation or people's efforts to combat it? And if so, in addition, does partisanship play a role in shaping the COVID-19 narratives?
Trust matters a lot in terms of thinking about how people are reacting and how people are protecting themselves or not protecting themselves. Right now, we know that trust in government is pretty low. Trust in media is also very low. And so for some people, they just have no authoritative sources of information that they feel like they can turn to for that type of reliable information on which to base their decisions. And that affects not only how they behave, but it also affects their tendency to cling to conspiracy theories, as Todd was talking about at the beginning, when they feel like they don't know where to turn, and these conspiracy theories give them some kind of comfort. And trust matters in a lot of ways. I mean, if you think about not just the response to it, but the recovery from it, a lot of this is going to have to be based on trusting that our public officials are making the right decision about opening things up or keeping things closed, trusting that we're getting good guidance about what's the right distance to stand apart and how can we protect ourselves and our friends and our family from the spread of this virus. Ultimately, people going back out into public life is going to be based on them feeling safe, And that requires that they trust that the government has the situation under control. Any kind of recovery first requires a response to the public health crisis. So the fact that trust is so low means that the government's already at a disadvantage. The media is already at a disadvantage in terms of getting people to believe that even accurate information, because people are so skeptical. And so it just creates this additional challenge in terms of getting everybody to have the information they need to make accurate decisions. You can think about that even like a couple years down the road, say we have a vaccine. Are people going to trust that vaccine and trust that it is safe to get? Are they going to know where to get it and how to get it? And our ultimate recovery is based on that. And in terms of your second question on partisanship, I think partisanship matters because our media consumption is so driven by our partisan affiliations or preferences. We know that people who lean right and people who lean left tend to consume very different news sources. And so they're getting very different information about the virus and about how to protect themselves and how dangerous it is. And so these alternative narratives become sort of self-sustaining and really very, very different and diverse from each other. And that means then that we have two very different views, maybe more than two, maybe up to 5 or 6 different pockets of people who have had different news consumption and live in different areas, so have had a different experience of the virus. And those differences also fall along partisan lines. And so we just end up with this situation where people have different beliefs and different experiences. And that is driven largely by news consumption and by our very different experiences and living conditions. The fact that our society is, we end up living with people who are like us. And that means that we have similar experiences with people who share our political views as well. Those overlapping cleavages contribute to the effect that partisanship has on these narratives.
I would simply add that the partisanship also presents an opportunity because partisan leaders are key leaders that people listen to. They have constituents that listen to and follow what they say. So to the extent that these partisan leaders can harness that opportunity and convey factual information, can work to debunk some of these conspiracy theories, and promote an effective public health strategy, then that could be a very positive contribution.
So let's talk about some solutions. What are the kinds of things we as individuals can do to help?
Well, I would follow the suggestions that Jennifer had earlier in this talk, to be careful what your sources are. I mean, good media hygiene, I think, is the way I would phrase it. Be careful of your sources. Don't share information without thinking about it. Use multiple sources. Recognize your own biases. All those are important places for every individual to start, so they don't contribute to the problem. One thing I'll note. I think policymakers obviously have a responsibility on this to talk with facts and support scientific strategies that are out there, and so that's important. Communicating with partisans, or what I mentioned before, and also I think regular, everyday social media users have a role to play. There's been data that suggests that as many as 23% of at least one survey population reported that they told somebody on their social network who shared misinformation that indeed it was misinformation. And so people are active out there trying to dispel some of these things. And data suggests that if they do that and also share trusted news sources along with that engagement, that type of engagement can be effective in reducing the spread of this content. So that'd be my basic suggestion. If you see somebody spreading this among your friends' social networks, let them know.
I think I agree with everything Todd said. I think it's important to recognize that it does require a commitment. It's not, you have to become an active news consumer. You have to be questioning and skeptical. You have to look for multiple sources, and all of that requires time. So you have to really make that investment. But ultimately, that is kind of essential to our ability to get out of this, is everybody taking an active role in being informed. And that extends just not beyond the recovery, the COVID recovery, to just thinking about moving forward, and like the health of our democracy long term requires that we're engaged. Another thing to think about is the role the media plays in this. I think there's responsibility on both sides. On the one hand, we need a media that provides us with fact-based information. There's no problem with having analysis and commentary and opinion, but those things should be clearly labeled so that it's easier for readers to then navigate that space. And then also on the flip side, for individuals thinking about supporting local journalism, paying for subscriptions to online sources. We often think that because something's online, it should be free. We're getting spoiled in the online environment where so much news and information is available for free. And I love something free as much as the next person. But if you really value the investigative journalism provided by some of the bigger outlets, that requires some kind of commitment. In the current environment, those outlets are really struggling. Many outlets have had to lay off reporters because they've lost all their advertising revenue now, and their subscriptions are already down. So I think thinking it through individually, like if you value journalism, if you value being able to get good information from the media, then you have to be willing to also support it. So I think there's responsibility on basically all sides of this issue.
That's really great, Jennifer. At RAND, we're very involved with COVID-19, and we've got various research projects across all of RAND on the various subjects. But could you talk about what we're doing at RAND right now to address disinformation and misinformation?
Sure. I think I myself been working in teams looking at conspiracy theories on social media, as well as testing out media literacy interventions. Online media interventions. But I think the thing I really like about working at RAND is just the diversity of researchers here. You have experts on so many different topics at RAND, and they bring so many different things to the table. So there's a lot of great work going on. People are looking at popular attitudes about COVID-19, the economic impacts on social distancing. Of course, there's work on misinformation and Russian and Chinese propaganda, FEMA planning, security for the elections. I think my colleagues here are working on a lot of different topics to really help improve the U.S. response to this.
Yeah, so we have a couple of projects that are focused specifically on COVID and mis and disinformation. One, thinking about mapping narratives. We know there's a lot of disinformation out there, but what are all the different narratives and who are they coming from? What's foreign sourced? What's coming from internal groups, and what are their motives? Just to get a sense of what's out there and where's it coming from. Second, we're thinking about how belief in COVID-related conspiracies relates to what we know about people's beliefs in other types of conspiracies, to understand, how a given person might be more or less susceptible to this type of information. We're able to leverage the American Life Panel, RAND's longitudinal survey, to do some of this work. And then we're kind of updating some of our existing work, thinking about how COVID has changed information consumption. We had a report on information consumption. We're trying to understand how COVID is changing that, and how COVID is affecting trust. We talked a lot about public trust, and we've been studying that for several years now, and we want to know what's COVID doing to that. Is it increasing? Are people feeling more trusting or less trusting? So those are the types of questions that we're really trying to use this as a moment to understand how a crisis like this affects some of the trends of what we call truth decay, and whether that informs our ability to respond to it more effectively.
Jennifer, Todd, thank you again so much for joining us today, for giving us a little bit of your time, but more importantly, thank you both for your research, for what you're doing to help us combat disinformation and misinformation during this trying time.
Thank you very much.
Thanks for having me.
Thank you all for joining us. We're grateful for your support and hope you continue to use RAND as a resource for trusted information now and in the future. I hope you'll also join us for our next RAND remote conversation on Thursday, May 28th. You can find more information about it at campaign.rand.org/events, or feel free to reach out to us via email at randremote@rand.org. Stay well, stay engaged, and stay tuned for more RAND remote opportunities. Goodbye for now.
Fact. Fiction. Misinformation. Disinformation. Do you trust what you see on the news today? What you read online? What your friends and colleagues post on social media? Can you have open, constructive conversations about our global future with those who may have different views? If you answered no to these questions, you're not alone. Our society is suffering from truth decay. It's not new, but it has become widespread. Civil discourse has stalled. People have disengaged from their communities. Inaction and reaction plague the policymaking process on vital issues, from education and healthcare to energy and national security. If we don't have confidence in our sources of information, if we don't know how to find the facts, if we can't be respectful in our interactions with each other, our way of life is at stake. But we have a chance to fight back with facts. We have a responsibility to restore facts to their rightful place at the center of decision-making and the foundation of policymaking. Imagine a tomorrow where analysis, not opinion, is used to make decisions about our collective safety and security, health and well-being. Imagine a tomorrow where dialogue drowns out the voices that shout the loudest. The future of democracy depends on our action today. Can you imagine a better tomorrow? We can. Tomorrow demands today.